neither the El Paso Medical Society, its members, nor PBS El Paso shall be responsible for the views, opinions, or facts expressed by the panelists on this television program. Please consult your doctor.
We are 2.5 years into COVID-19. Here are some answers that we're going to give you tonight about a lot of myths that are circling around vaccines still. There are boosters. There's still the flu vaccine that we're not letting go of quite yet. And this is a special program that specifically addresses why there may be some hesitancy of vaccines, specifically in people of color. COVID-19, the Delta variant, the Omicron variant, the BA2, Omicron, some variant, et cetera, et cetera, et cetera. And I'm sure there's going to be a lot more that still comes around. But we want to kind of talk about what is the new normal. What does that mean? What can we expect? And what can we best do for ourselves to address our health going forward? And I say going forward, I'm not just talking about this year, but the next decade, the 2 decades coming up. It's a science, and we all know that. And although we do wish it would all go faster as far as what's happening with what variants and how are we getting boosted and is this all going to work, we need to respect that this is a science and it's still new, and there are studies that are still constantly being done on every single aspect of this. It takes a bit of time to get the answers. Again, that's where we're asking for patience. The medical community is asking for patience. And it takes a bit of trust with experts in this area. And Dr. Banda and I, that's specifically we're going to talk about quite a bit this evening. There are some questions, a lot of them, and this is the show to ask your questions. It's a great time for you to call in and ask those questions. We have Zaid Zakli hanging out with us, and he is going to be taking your calls at the number of 881-0013. He is a volunteer with the Texas Tech Paulo Foster School of Medicine. And again, we want to say thank you to the El Paso County Medical Society because they've been bringing this show to you for many, many months. I'm Catherine, many years. Did I say months? Months? Yes, but also 25 plus years. I'm Catherine Berg, and you are watching the El Paso Physician.
It's interesting because I'll have some of these doctors on the show, and yeah, they're doctors, but I've known them for 20 years. We've been doing this show for 20 years. You know, he talks about farts, and he talks about diarrhea, and he talks about all kinds of things that nobody wants to talk about. And that's what's great about the show, because you get to hear those things on the show and go, I'm not the only one. It's great. It's the El Paso Physician.
Hello, this is a special program. We're going to be talking about COVID-19. I know that's not new. We're going to talk a little bit about the flu, but we're going to talk about people of color and how the virus affects them, but also how vaccine hesitancy affects this entire area. So I'd like for you to join me in welcoming, and I love your name. This is Dr. Melo Banda, and she is great. We've been having a lot of conversations already before the show. And I do want to give a little bit of background of where you're from, because you are globally aware of a lot of what we're going to be speaking about this evening. And I think it's nice for our audience to be aware of that. You're from Zambia, which is South Central Africa. And then you went to school in Grenada. And then you somehow landed in New York. And then somehow landed in Oklahoma. And now you're here.
Correct.
So thank you for joining us.
Thank you for having me, Catherine.
You're very welcome. You specialize in family medicine. And I think for some people that seems like such a broad term. But if you could, to our audience, kind of explain what you do all day, every day, so that as we're talking and as people start asking questions, they're like, okay, well, Dr. Banda's kind of heard this from patients, and she's heard this from schoolmates, she's heard this from different places that you've studied around the world. So in family medicine, how would you describe that specialty?
Well, it's a very broad specialty. We take care of newborns to the very elderly. So we do deliveries, we're in the hospital taking care of patients, and we're in our offices seeing patients for appointments. So very broad spectrum, really interesting field, I should say.
In the last several years, I'd imagine it's just been crazy because COVID affects everybody, right? It affects every age, it affects every walk of life. And so it's great that that's your specialty because we are looking at so many of those questions right now. So when COVID hit, and again, it's been 2.5 years, actually of these places, where were you at that time? Were you in New York at that time?
I was in Oklahoma.
You were at Oklahoma at that time.
Yes.
So talk to me about, just in general, what you were doing when COVID hit and how that changed your life as a doctor?
Okay. So at that
Good luck
time,
with that one.
I was in residency. I believe my third year, my final year of residency during that time. So everything was brand new. As residents at the time, we were actually taken out of rotations with patients who had COVID-19 in the hospital, and our attendings would actually go in to see the patients just because nobody knew much of what was going on at the time. And so it was a scary time as a physician and as just a normal person, and obviously having a family at home, you don't want to take anything back to them. So yeah, it was a interesting time.
Crazy.
Yes.
So as a resident, if you can describe to me some of the residents that weren't sick, that did get to kind of hang out. And the reason I'm asking this is that I think so many people at home, nor myself, even though we get to do these interviews, we don't really get to see it unless we have someone in our family that's in the medical field, that's on the front lines, that is right there in front of everyone.
Right.
So just having conversations with your colleagues, with other students, with doctors that have been around for 50 years and doctors that are brand new, how were some of the mentors that you had around you, how were they helping you out with how this was all folding out?
Right. There was lots of support from my attending physicians at the time. We would gather together at least once a week to listen to updates from the CDC together, and then they would answer questions that we may have had at the time, which is really good. And then they would check in on our wellness as well, mentally, just to make sure everybody was still doing good despite everything that was going on.
So what was your first several cases where you knew, okay, this is something that is going to be hanging out for a while,
Right.
and it's not going to go away? And if you can just describe some case studies that you were involved with, obviously no names, no anything, but you know, the severity of what was happening, because there was a while there that people thought, oh, this is going to go away. It's, you know, I don't want to use words that will use the media,
Right.
but there was an idea for a while that it's just a little thing.
Right.
The reason, again, I'm asking that is the severity of that, and it's not just in El Paso. Again, you were in Oklahoma, you were in New York, you were in Grenada, you were in Africa. I know you weren't there during the COVID time, but what were some of those cases like?
Right, no. Just the rate of death itself during that time was a big wake-up call. Here in the United States, and I can speak about even back home where I'm from in Zambia, Africa, I was obviously not there to experience it personally, but I would get phone calls and updates. The death rates were just incredible. And at that time, we unfortunately didn't have enough vaccines in the country. And we really do have limited resources in terms of health care. So the death rate back there was really high, and even here in America. So just seeing that was an eye-opener, seeing, the refrigerators placed outside of the hospital. It was just a very sad, heavy
Right.
time.
Yeah.
Yeah.
And we're here specifically today because we do want to talk about people of color and just disproportionately how the virus hit, and then also later on too when it comes to vaccines. So I have a couple of statistics here, and I know Gracie, we kind of practice this a little bit, but what I'd like to do, Gracie, if we can go to the third slide that you have, which would be the El Paso demographics, because I want to start out in El Paso, because that's what we're most familiar with, and then we're going to go around from there. But the demographics here in El Paso, Horizon City, we've got 22,000 as a population. In El Paso, we have 800 some odd population. Again, you can read it there on screen as I am. State of Texas, 29 million. In the United States, 300 million. And then this is where the breakdown is. So people of color, Hispanic or Latino in Horizon City, 89%. El Paso County, 82%. State of Texas, 39%. So there's a big difference there. We all know this already, but it's just nice to actually see it on paper in the numbers as we're speaking about this in a specific format this evening. Black American for Horizon City, 3.5. Black American in El Paso, 4.0. And then State of Texas, 12.9. So that again is a different type of a disparity. In the United States, 13.9. 0.4. And what I'd like to do, Dr. Banda, is just historically, and we've got some other graphs that we can look at too, but just historically, the way that treatments, I'm going to see how I actually had that question worded originally, the way that COVID has affected African Americans, and I know in El Paso we have a higher looking of Hispanics, we have a higher population of Hispanics, but you in your world, coming from Africa, studying in different areas, African American populations, I know there's not a big population here in America or in El Paso, but how have you seen that specifically as a person, Black American person, somebody from Africa? Again, I'm repeating myself, but you also see Hispanics when you're in El Paso, and there's a different population. As I'm giving these, when you're in New York, those are all very different. In Oklahoma, those are all very different. So just from your perspective and viewpoint, why is it that there are disparities in different communities?
Right, that's a really
It's
good
a
question.
hard question. It's hard for me to
question.
ask because I don't know exactly how to balance the question.
Yes, well, just going back, I want to talk first about, vaccines and how people, especially African Americans, are very hesitant to get to getting vaccines. African Americans actually have one of the lowest vaccination rates among the ethnic groups. About 5%. And I'm talking about the first dose of the primary series of the COVID vaccine. We have 5% who are Black people compared with 60% who are white people. So we ask ourselves why, why this disparity? So looking back, there has been institutional racism and, historical inequities in healthcare, and these have played a role in vaccine hesitancy. We can look back specifically at the Tuskegee case or the Henrietta Lacks case.
You know what? Let's talk about that because I don't think a lot of people know about that.
Yes.
So let's talk about that really quick.
Right. So just a quick summary, the Tuskegee case was about African American men at the time who had syphilis were put into a study and they were promised medication for the syphilis, which they did not get at the time. And as a result of that, led to death and, severe medical complications. And
do you remember what year that was?
Oh, I can't put my head.
Okay.
The 50s, 60s.
Yeah, in the 50s, 60s. So it was again, this is a historical viewpoint of what you're going back to and referring to.
Yes.
Okay.
And I want to say the Henrietta Lacks case was around the 1920s, but this was a woman, Henrietta Lacks, who had cervical cancer at the time, and her cells were taken from her, but without any consent, and her cells were actually used in research and I believe are still being used in research. So today that brings up a big ethical dilemma. So looking back at cases like this, the people of color could be hesitant at getting the vaccine as it's so new on the market. Other reasons could be a lack of diversity among healthcare workers and also substandard services and care afforded to patients who may be living with poverty or just are part of the people of color community. Yeah.
And I was reading to prepare for this program, we were talking about Black Americans are overrepresented in essential worker positions.
Yes.
So in the beginning of COVID-19 with essential workers, there was more exposure to the Black community. And if we can talk a little bit about that, and you, can I have fun with you?
Yes.
Because this is the way I roll. This is Dr. Banda's notebook. These are my notes. I love people that do this. I do. You're so stinking cute.
I don't want to miss anything.
I love it. I get it. Because I was going through all of these and because sometimes they just sit there and they just talk through. But I'm like, I need my cheat sheets to go through, right?
Thank you.
So it kind of goes to, so again, essential workers on the front line, exposure, exposure, exposure. And from there too, because we were seeing in the news just people that are watching TV or listening to the radio are like, well, why are there so many more African Americans or Hispanic or just simply put and all of that, people of color that are getting COVID other than other represented.
Right.
I'm trying to say this correctly, but essential workers, let's go with that, because we didn't know, is there a predisposition physically to
Right.
somebody? Is there a gene difference? Is there a DNA difference?
Right.
What is it? But then as time was going on, it's like, well, hold on. This is where this group of people is working, and this is where this group of people is working.
Right.
So that's where I'm going, even though it took me a really long time to get there. Goodness.
You got there.
Thank you.
All right. So when it comes to that, like, how has the African American community been affected by COVID-19? As we already know, like you've pointed out, the people of color community experienced a disproportionate number of cases of COVID-19 compared to other communities. Some statistics, like taken from March 2020 through May 2020, for Black Americans showed actually that the average weekly rate per 100,000 was about 36 cases, about 16 hospitalizations, and about 3 deaths. So some driving factors for that were, again, African Americans make up most of the essential workers.
Okay.
Yes, so they were out in the front line and being exposed, but also pre-existing structural and social inequities, you know.
And I want to talk about social inequities because we have that in, again, all the places that you've lived, and then coming from, again, from Africa, then to Grenada, and then to America. And again, America is not just one place.
Yeah.
I mean, it's very different in New York than it is in El Paso, than it is Oklahoma.
It is.
And again, I know we can spend 20 days on this, so I'm trying to cram it all in to give a picture of what we're talking about.
Right.
So the disparities in New York compared to El Paso, what would you say that was like?
Oof. I would say, in terms of social inequities, you mean? I would say it's pretty much, it would be pretty much the same.
Okay.
Yeah, in
Okay.
comparison to here in El Paso so far, being here.
Okay.
Yeah.
And in Africa, I know you weren't there during COVID, but with family and just listening to everybody there, you said there were fewer resources.
Yes.
In general, kind of compare that with what was happening in America at that time.
Well, access to care, access to any kind of health care, whether it's COVID or something else, firstly is difficult. And then once you get seen by somebody, it's very hard to seek, let me say, specialized care. So specialists are very limited. You be put on a wait list for years, even, you know, before you are able to see somebody, unless you have the money to
Exactly.
pay for it out of your pocket. And we don't have medical insurance back home, so it's self-pay, out of pocket, or nothing.
And so social inequities, going then, that I feel like that's a perfect transfer to there. And the way that federal and state governments help out with that, the way maybe public health organizations, if it's county health, if it's city health, how have you found that to be? And I'm asking for El Paso because I don't know where else to ask about right now.
Right.
But just in general, with all this in mind, how do you think that El Paso is doing on that front?
So today, the rates of vaccination are actually, looking at the African American community compared to the rest of the community, the rates of vaccination are on par with other ethnic groups, so that's great. And that's because of efforts, you know, from different institutions, from private to public to religious institutions, kind of advocating for this cause.
Okay.
Yeah.
So that's where you see the major change. And do you see that have been happening in the last decade, last 2 decades, last 5 years? How would you rate that?
I think that's been happening over the last decade, probably more.
Okay.
But yeah.
Okay. And so here's the next question. Where do you foresee that going, the inequities? Do you see that balancing out more and more as we go further?
Definitely. With inclusion, even with inclusion of more people of color in the medical field, maybe that makes the general public more comfortable to seek out care just because they feel like they have somebody in the field who's been where they have been and who understands them more. So definitely I see things improving.
Yeah,
as
like we
move
were saying
forward.
here, there's a better representation and diversity in the healthcare practitioners.
Yes.
Which is something that has more and more throughout the years too. And I'd like to kind of go away from that for a little while and then talk specifically about, all these variants. So I'm going to go back to the beginning of when we were talking. So I wanted to make sure that we got that in, because I know that questions from the audience are going to start pounding in really quick. And so here come the questions about vaccines. We were talking about hesitancy, and in the Hispanic community, we had quite a bit of hesitancy in the beginning as well. El Paso has turned out to have one of the higher vaccine rates in the nation, and if you can speak specifically to that, I would love for you to do that at this point, because we're so proud of ourselves right now.
Right,
There was a
definitely.
big effort. A lot of the all the hospitals got together. Hospitals compete, right? But when it came to this, they didn't. It was time to make sure that we were doing well.
Definitely.
So brag about El Paso, if you could,
I
on
will.
how we're doing with our rates with vaccines.
Definitely. So in the beginning of the pandemic, El Paso was one of the places that was hit hard with the
That
pandemic.
first fall.
Actually, yes, right before I moved here to El Paso. So since then, healthcare organizations and just other organizations took it upon themselves to increase the number of vaccines available to the community. And they went out as far as opening sites outside of the pharmacy or healthcare related places for people to easily access vaccines without many questions asked in terms of insurance, or so people didn't need to worry about paying for the vaccine.
And this is where I like that word of inequity.
Yeah.
We're trying to make things more equal at
Right.
that point. So it really was, and I loved how you said, well, there weren't a lot of questions. It's like, you need a vaccine, we're going to give you one.
Right.
Just tell us who you are, so you're in the
Exactly.
system. So if there's a way that we can track you going forward.
Exactly.
And I thought to me, that was impressive. First, I was like, man, that's happening fast. It was almost scary. But at the same time, and it was time when, for example, I'm 55 and I had no underlying condition, so I felt like it's going to take me forever to be able to get mine. But when you were ready, there
It
were
was
places
there.
to go.
Yeah.
And on that note, we're about a year and a half, a little bit more than a year out of the first vaccines. How do you see? I know that there's been a drop. There was the first vaccine, that was pretty high. Second vaccine, pretty high, but not as high. Boosters, it's kind of dropped off quite a bit. Now that we are in the area of the second booster, maybe talk us through that, of what people's thought processes are.
Right.
Is it like, oh, it'd go away, it's not as important?
Right.
I'd love to hear, as a family practitioner, what
Definitely.
your patients say.
Yes, and talking to my patients about the COVID vaccine.
Right.
Most of them have received, the primary series, but a lot have not received the booster. And I ask why. For some of them, it's because they had side effects from the initial primary vaccine, and they don't want to experience that again, and they feel like, if I have the primary series, I don't really need a booster. And even after the primary series, a lot of patients have still gotten COVID. So that is another a comforting thing to them, in the sense that I now have immunity because I have gotten COVID.
Oh, there's a good transition here.
Right.
Yeah, let's talk about that. Yeah. We've done, I don't know, probably 6, 7, 8 shows right now during COVID, about immunity. And if you can explain why we have reactions to the vaccine, it's a good thing.
Right.
It's a good thing.
It is.
So if we can explain to the audience why it's good, you're going to get the COVID vaccine, which means you get a little bit of COVID, but not like crazy COVID.
Right.
Your body reacts to it, which is good. And if you can explain as a doctor, why is that good?
Right. So reaction to a vaccine just means your body is building the immunity. So once you get something foreign in your body cells are like, hey, what is going on? So the defense of your body is now awoken, which is your, white cells. There are different kind of white cells, and they start to try to get rid of this new thing that's in your body, and that's in the sense what builds your immune system. So in the process of these white cells fighting off this foreign thing in your body, you develop the antibodies you need to fight off a real COVID infection.
Exactly. I'm glad that you explained that. And I know earlier in the program when we were doing the opening statement, we were talking about, again, first there was just COVID-19, then there was the Delta variant, then there was Omicron, and then the BA2. And there may be other ones coming about.
Right.
And the reason I'm bringing this up is that, okay, now with the booster, we're 4 vaccines in over the last year-ish, year and a half. And I know there's no crystal ball. Just like we said, it's a science. We're trying to figure it out as we go. But it's also, studied before we throw it out there. But with COVID, it's not going to go away. It's going to change and mutate and do this and that and the other. It tends to be getting weaker and weaker, which is great.
Correct.
But if you could describe why it's still important to, when it's your time to get a booster, when it does come time for flu season, et cetera, going forward. This is like the golden hour of the show, the golden 5 minutes. Like, why do we keep needing to get these vaccines?
Right.
What is our body doing? What is the virus doing that makes us need to get the vaccine?
Right, definitely. So the virus, I would say the virus likes to change clothes. So likes
that's
to
a
wear,
good way of saying it.
right,
Yes, right.
likes to wear a new coat every time it comes to a new potential host. So our body will recognize the coats that it's seen before. So if the virus comes and it's wearing a different coat that we've never seen before, it's easier for the virus to attack more cells of our body. And if more cells are damaged and destroyed, you have more severe symptoms and complications from COVID, even though you've previously gotten vaccinated or boosted. The vaccine was against a certain kind of dress, and the booster. So it is important to keep up with the COVID vaccine, just like we keep up with the flu vaccinations every year.
Exactly. And that's actually a good point. I don't know if people know that the flu vaccine is a little bit different every year.
Yeah.
So this is a great time to talk about that too, because even though we're talking about COVID and mutating and changing, the flu, just influenza, changes and mutates, and it's a little bit different every year. That's why people have to get a new flu vaccine every year.
Exactly.
And if there's anything that I'm saying that's wrong or off, let me know, because this is all the stuff that I was learning as we were going through this too. I am a believer in vaccines, always have been. And some of my friends are like, well, I've never had the flu vaccine because it gives me the flu, which is also why I'm glad we talked about these side effects.
Right.
Yes, if you do get sick for a day or two and you get the sniffles and your body reacts to it, it means your body's doing exactly what it's supposed to be doing.
Exactly.
When we're looking at people who are now 3 vaccines in, maybe 4 vaccines in, when I say vaccines specifically on COVID, the 4th vaccine is available, but there are people that are in the position of, I've already had 3 of these pumped into me. I'm just going to wait a while. And these are people past the age of 50, but not in a category where it would be dangerous for them not to. Is there any specific advice on that? Is there advice in, if the 4th one's available, take it now, or you can wait a couple of months still until we start getting in the flu season? What are your patients asking you?
Right.
And what are your, you and your colleagues?
Right.
Because I know you're getting asked this all day, every day, in the grocery store, wherever you happen to be standing, they're like, hey, Dr. Banda, how is this working? So what's your answer to them?
Well, yeah, I would say definitely would recommend, as soon as you can get the next available booster, do get it. Because like we know, you mentioned earlier that the new variants are getting weaker, so they're becoming less virulent. But cases are climbing back up.
Right.
We're not seeing as many patients in the hospital because, of our vaccination rates, and probably the virus is less virulent. But we still want to be protected, especially if we still want to, enjoy time with our family and not worry about, oh, do I have COVID, or am I going to give somebody COVID or get COVID myself? So it allows us kind of a sense of peace of mind to get back to what we call normal before the pandemic.
Right.
So definitely do go for that booster if you have the chance to.
And I'd love for you to talk about just case studies, people who, again, have no underlying conditions, had COVID, it was relatively mild, but it just kind of lingers and lingers and lingers.
Right.
And I want to bring that up too, because people think, well, again, I'm 50, I'm in great shape, I've had my 3, I'm going to wait a while. But then maybe there's that magic subvariant that for whatever reason your system doesn't like that one.
Right.
And there's a lingering out there.
Right.
And go to town on the lingers that you've seen and just responses that you've heard from patients that are like, oh, I wish I had taken this more seriously.
Definitely. So that's the long COVID, we're going to call it. Yeah.
Even
so
if it's long, mild COVID.
yes, exactly.
You know, it's still like I still can't breathe as well as I did prior to this COVID, even though they're not
Exactly.
really laboring or really not able to go to work or what have you.
Exactly.
But those issues as well.
Right. So that will happen. It doesn't matter if you had a mild COVID. It doesn't matter if you were, moderate or in the hospital. Anybody who's had COVID before, asymptomatic, anybody who's had COVID before could have what we call long COVID symptoms. And these are symptoms that either linger on from an initial infection, they stay more than 4 weeks, or they appear suddenly 4 weeks after an initial COVID infection, even when you didn't have symptoms. So these can be anything from, shortness of breath to cough to, pain, joint pain, fatigue. You can even have like some psychological conditions, depression, anxiety, PTSD. So all these things can happen and we don't know how long they last for. But what we know for certain studies have shown that actually getting vaccinated reduces your chances of getting long COVID, even if you got sick with COVID.
Right.
So, and staying up to date.
I would love you to repeat that, if you don't mind. I feel that my mic's kind of scratching. I'm just going to make sure it's still in the right place. But if you could repeat the people that have had COVID, that they think, okay, I don't need to get the new vaccine or a booster, but they still do, again, those other variants there.
Yes.
I want you just to repeat what you said, because I think that's so vitally important that people aren't getting. It's like, well, I had it, so I'm immune, it's gone. It's gone.
Right.
It's not.
It's
and
not.
maybe we can talk about, like we were talking about the flu, the mutations and the way things change.
Right, it's not gone. So you're still at risk of getting long COVID if you are not up to date with your vaccinations, and that includes the most recent booster. So I highly encourage everybody to go out there and get boosted, get vaccinated, get boosted.
So here's, and this is again global looking, and we may not have an answer for this yet. So we are now on our 4th booster. And I could be wrong, but did that, I guess about 2 months ago, is when people who had underlying conditions were available to get that, right? So we're about 2 months out of the 4th booster. And in your mind, and or what you see in the medical community, in the research community, what might you see going forward? Is there booster number 5 or 3rd booster?
Yeah.
Coming up maybe at the beginning of the year? And if you don't have the answer, that's fine. Or again, there's a disclaimer at the beginning of the show that says we're doing the best that we can to answer what we know.
Right.
And again, it's all changing constantly.
Yes.
So I'm just asking, as someone who's in the field and around it all day, every day, how often do you see, let's say the next one, and then from there, I think we're going to find a lot more, like it's going to be a regular yearly flu vaccine, maybe flu and COVID combination vaccine.
Definitely. Yes.
What are your thoughts on that?
Yes, so that's a good question, Catherine. I think just like the flu, it started as a pandemic, and now we're here today, and we need to get our flu shots every flu season. And so the more we learn about COVID, we're going to learn about when it's most prevalent. Is it there throughout the year? Are we going to have to develop a vaccine that's whose potency is going to last for the whole year? Or is it going to be a seasonal thing? So for the future, I do anticipate we will be getting, at least a yearly COVID vaccine, if not more.
Okay.
Yeah.
And this next one, and just maybe some of the circles that I'm in, I think this next one will probably be around February, March, when we see that fifth one kicking in of when those of at-risk populations, it's going to be available. And then from there, and again, I'm just repeating what I've read, and this is something too, and this is, I should talk about this regarding getting your information. And as a doctor, we kind of joke about Dr. Google.
Yes.
You know, Dr. Google's he's not certified, he's not peer reviewed. Dr. Google's out there, but if there's a website you want to go to, see if you can have .org behind there, or .edu. .org means it's an organization, which means it's not a for-profit place for you to get your information, or .edu is an educational institution.
Yes.
In general, I would love to hear your advice to the audience of if they're really looking for information, and let's say they missed half of the show.
Okay.
If they're looking for information, where should they go to get true, real information, not that freaks them out and it's somebody else just saying, oh, I had this and I had that, but easy, accessible information?
I think I would say Medscape.
Medscape?
Would be a good resource.
I don't know that one. I like that. Medscape or just?
I would say it's .org. But
Medscape.org most likely. That's what I'll
most
look
likely.
into for the next one. Okay.
Yes, yes.
Okay.
I have up to date, but that would be like a subscription, you know, if you want to get more information about what you're looking for.
Okay.
Up to date is always a good source as well.
I think I may have some here from other shows. So the ones in Texas specifically here is the Department of, we have dshs.texas.gov /coronavirus.
Okay, yeah.
So that's a good one too. So Department of DSHS, Health Sciences, not sure what that is, but dshs.texas.gov and then /coronavirus. And then that might be a place you can go to then. So .gov is one of those, edu, .org, and .gov. CDC is always a good one to go to, so that's cdc.gov. And then from there, usually you can find the search engine, but usually a / and then throw in the word coronavirus, or you can put in subvariants, etc. And then the World Health Organization, which is WHO, WHO, and that is .int on that one. So sometimes it's just nice to have that. And of course, with El Paso, we've got EP Strong as well, so it always has information on what's going on here.
Yes,
and on that note, for vaccinations, say people who are getting the 5th booster, where can they go at this point for the 5th booster?
Sure, yeah. I would say pharmacies.
Okay.
Walgreens, CVS, but for most of them you would have to book an appointment online before you walk in. But yeah, that's the fastest and easiest way I know.
Okay. And as far as, and if you haven't had your original vaccine yet either, again, the questions are, it's free.
Yes.
That's the biggest thing we need to say, it's free. If you have insurance, they do take your insurance information.
Right.
And that is good for you because you want the insurance companies to know that you are being diligent and trying to get this done. But they're absolutely free.
Right.
And so please do that. What are the ages now? I am not completely kept up on that.
Right,
so
yeah.
for the second booster, where are the application of ages at this point?
Okay, so you're talking about the fourth one?
The fourth one,
Okay.
yes. The second, yes, the fourth one.
So for the
and I
fourth,
should talk about what each one of them contains. That's something too that's a question.
Okay.
So go ahead. So the fourth
So
one
for the fourth
ages.
one for ages, it will be for the ages 5 to 17. We're looking at those people, those children who have moderate or severe immune compromised conditions.
Okay.
For example, are suffering from cancer or are on any treatment that reduce their immunity for any reason.
And that's perfect, and thank you for saying that. We have slide number 1, Gracie, and that might kind of help us walk through some of what we're talking about here, because some of the questions also come in with, was it the Pfizer shot first, was it Moderna, and now that we're talking about boosters, the Johnson & Johnson doesn't have a booster approved yet, so this might be something to talk through this as well. So I don't know how good your eyes are. My eyes are not that good, but here's my cheat sheet if that helps. But it shows there the 5 through 11 years. If you did get a Pfizer, and again, these are biotech, and that's, do you want to go into what biotech is?
No.
Do you think, okay. That gets to be too complicated for a short show. But so those are the 3 doses at this point, and then Johnson & Johnson has the 2 doses for 18 and plus. But again, that's where Johnson & Johnson doesn't have the booster shot recommended yet.
Right.
And for someone who doesn't understand that, do you have an easy way to explain that?
Well, it went through testing, and I guess it was not approved yet. So I believe there's still some testing going on.
Which again is something that we talked about earlier. This is where we need to have patience. There is testing, and they're not going to throw something out into the market that hasn't been tested. That's why it took a whole year to get a vaccine.
Right.
If they're throwing stuff into the market that isn't tested, it would have been out there immediately. And so that's important for people to know. And it has just here on the doses too of how long you should wait. Again, you can get this on any of the websites that we show to, and as you know, the American Heart Association is underwriting this program, and so the American Heart Association, American Cancer Society, a lot of the medical organizations, nonprofit organizations have COVID-related information. For example, the American Cancer Society will be specific on COVID vaccines and a certain type of cancer that you have. Also very dependent on who your doctor is, talking to your doctor and making sure that your healthcare provider walks you around that when it comes to that. So let's talk about, since you are a family doctor, let's talk about little ones.
Okay.
And when I say little ones, let's say 12 and under, because they really are little.
Yeah.
You know, because I've got teenagers and they're not that little. But in the beginning of COVID, it seemed like there was this false immunity or this false thought of immunity. And then as time started going, it was the fact that kids are not immune, children are not immune. And then also, too, with testing, it also was the idea of, well, why is it taking so long to get a vaccine for little ones? Because again, there's more testing.
Right.
So when we're looking at children going to school all day, every day, mask, no mask, there's controversy there, and this one thing we don't want to talk about on the show is politics.
Right.
But again, as a medical provider, how are you advising families who have generations at home, like that literally could have 4 generations at home?
Right.
There's great grandma, grandma, mom and dad, and the kids. And that's not uncommon, especially in our Hispanic community. Families really all live together.
Right.
So you're looking at some that may be immunocompromised, some that are going to school every day and, you know, getting their 5- and 6-year-old hands on everything and, you know, moving their nose. And what are some of the questions you get, and what advice do you give?
Yeah, so is it safe for my children to get the COVID vaccine, even if it's so new, it's out there? You know, what are some of the side effects? Are there any serious side effects from the vaccine in this age group? What are some of the reactions after they get the vaccine? Those are some of the questions that a lot of parents have asked. And like you mentioned, if you live in a household, or even if you don't, you just, kids and with your parents, or they're elderly in the house, there's somebody who's immune compromised, you know, we want to kind of achieve herd immunity for your family.
Oh,
okay?
there's that word, herd immunity.
Yeah.
Okay, let's talk about that. You know, actually, I think that means different things to different people. I love that you're here. So, herd immunity, what does that mean from a medical standpoint?
Okay.
Yeah, I'll just stop there, because I could go into subvariant areas too. So what does that mean? What does herd immunity mean from a medical standpoint?
Right. It will mean that the majority of the population that is eligible to get vaccinated has received the vaccine. Therefore, the chances of spreading a certain disease or infection within that population is significantly lower compared to if the population that is eligible for the vaccine has not gotten the vaccination or is not where they're supposed to be with the vaccination rates. And that leaves chance for more spread of the infection and complications, right?
So here's a question, and I didn't prep you for this, and I didn't prep myself for this either, but we are on the border. We've got Mexico right next to us, and when the vaccines were first being rolled out, there was, talk about inequity, there was not vaccines all around for people who were, and the borders were closed at that time, but for families that live on both sides.
Right.
And I don't know this, but do you know where we are in that world of Mexico Juarez vaccinations compared to El Paso?
Unfortunately, I don't.
Okay.
But that's a very good question.
It is, and that's a
yeah.
question that I will ask. And you guys are welcome to call the either call the El Paso County Medical Society, or somehow you can get a hold of us through here at Facebook. Because I will ask that question myself, and I should have asked that before coming here, because that would make me curious as we are.
Yeah.
And on that note, too, again, coming from Africa, studying in Nicaragua. Or is that where you were?
Grenada.
No, Grenada.
Yeah,
I was
yeah,
going to
yeah.
say, studying there. So I'm imagining you kind of follow different areas around the globe.
Right.
And how are people doing globally? And where are some of the disparities around the globe?
Oh, good question. So I'll speak about Zambia because
Okay.
I have a personal attachment to that.
Right.
So far, much better. Vaccination rates have improved. There have been donations from like WHO and other organizations who have brought more vaccines into the country. So the vaccination rates increased and more people went out to get vaccinated, just seeing other family members either having severe COVID or passing away from COVID. So the numbers have reduced significantly from the beginning
Very nice.
of the pandemic.
And so the hesitancy idea in say specifically where you were born, where you grew up, the hesitancy, does that, like you said, does it go away as other families are also now taking that? And there's I forgot the joke of it, but there's always one lady on the street, and if that lady does it, everyone on the street's going to do it.
Yes.
If that lady says no, nobody's going to do it. So I feel like every neighborhood has that, and when I say neighborhood, every community has that, maybe every city has that, maybe every country has that.
Right.
And so is that how you see it kind of working with hesitancy? So, because I know we're looking at people of color specifically,
Yeah.
hesitancies, why the hesitancies, and I love the way you were talking about that is starting to little by little get better to where it's the inequities are starting to dissipate.
Right, definitely. So yes, it's much better. Back home in Zambia, I would say even when other people saw other people get vaccinated, they didn't want to get the vaccine because they were still scared about it being very new and, you know, complications from that. But it had to take, and this is very sad to say, but it's the truth, it had to take a lot of people, you know, to die from COVID for the nation to actually wake up and say, okay, maybe I need to get this vaccine myself to protect me and the rest of the family.
And it took us back in, you know, Spanish flu times. Was that 1918, I think? If I'm wrong, somebody correct me. But that was a good 3-year turnaround until things got herd immunity, I guess.
Right.
But that was mass. There really wasn't a vaccine situation at that time either. And it was a whole different world of research and trying to figure it all out. So when we're looking at this, it's still, again, it's still a science that we're looking at globally.
Right.
I'm going to stop my questions for a minute because I know that you brought all kinds of stuff in your notebook, and I want to see if there's anything that you'd really like to get across this evening that maybe we haven't talked about yet. If there are just some ideas or, again, whatever advice you get, but at this point on, it's your show. Because this hour goes by so fast,
I know,
you know, and
right?
we've got a whopping like 10 minutes to go.
Yeah.
So whatever it is that you'd like to talk about before we wrap this up, because it goes so fast.
Right, yeah. Well, I would say just going back to the vaccine, it's very important for you, for your children, for, you know, your friends. If you're watching the show and you have friends who you know who have not received the COVID vaccine, to talk to them about getting it. And if they're unsure, to have them visit with their primary care doctor and discuss, you know, what are the risks and what are the benefits of getting this COVID vaccine, which hopefully would encourage them to get it eventually. But if you have children that are at the age that are eligible to receive it, I highly recommend that you get them vaccinated as well. it just gives you a sense of, peace of mind when you send your kids off for now summer camp or whatever activities they have going on, that, they'll be safer. They still might get COVID, but it might not be as serious as it would be if they did not get vaccinated.
I'm going to ask you to repeat that again, because I just find these little golden nuggets that you're saying. You may still get COVID. So, the idea, the myth of, well, I'll get the vaccine, but I know people have gotten the vaccine and still got COVID. Yeah,
Right.
but they're alive.
Right.
And maybe they didn't go to the hospital, and maybe. And that's the whole thing about when we get the vaccine, flu, COVID, whatever it is, our body does react to it. So yeah, you may get sick for several days,
Right.
which means your body's working for it.
Right.
So I just feel like the more that we can say that, because the myth is out there, I'm going to get the vaccine, I'm going to get COVID, or I'm going to get sick, and I don't want to deal with having a fever for a day or two. I don't want to deal with being lethargic or tired for a day or two.
Yeah.
It's better than what?
Better than getting those symptoms and having them last for months, or ending up in the hospital and having a disability because of COVID, or even dying from COVID. So those short-term symptoms of just sore throat, cough, they can go away within a few days if you have gotten vaccinated.
And again, the beautiful thing is it means that your body's working.
Yes.
So if anything, thank your body for giving you a little bit of pain for a couple of days. I have a question here from the audience. Dr. Banda provides primary care at Texas Tech Physicians at El Paso, at Trans Mountain when, please say that when I'm wrapping up the show. So that's what I'm saying, that you provide. Thank you very much. Is that you, Patrick? You're hilarious. I love it. There's another question here from the audience, and I'm not familiar with this, but FDA advisors back the Novavax COVID-19 vaccine. Do you know what and if you don't know what that is?
No, sorry.
I have no idea. So
Yeah.
that's fine. As a fourth option for U.S. adults. I'm not familiar with that. I know that was a question from the audience, but I am not familiar with that one either. And trying to see what this one is here. So this is how we're doing life these days with COVID. In the old days, I was actually joking with someone, is that I'd have my kids or somebody else's kids would write down the questions behind the scenes and they'd sneak them up to us. But with COVID, we're keeping our distance. I'm getting all the questions right now on my telephone. But Medscape Medical News, so thank you very much. Patsy Slaughter sent this my way. Patsy Slaughter is the director of the El Paso County Medical Society. And when she heard us talking about that, she sent the information our way. So Medscape, if you just put that in the search engine, there's all kinds of great information here. Meet the FDA agents who help out with different things. But this is a really good website to go to. And on that note, I'm going to give out these websites once again. One of them is dshs.texas.gov. And again, with all these, once you get to the website, you can go to the search engine and find out what specific issue you're looking for. I know we're talking about coronavirus today, flu, but really any other issues that you have a question of, you can put into that as well. CDC, that is a really nice website to see what's going on up to date, what mandates are. And maybe you can talk a little bit about the role of the CDC, because we hear about CDC on the news all the time. We hear about World Health Organization on the news all the time. What do those two organizations do?
Okay, Centers for Disease and Control. When we have things like pandemic, they're at the forefront, trying to see what rules and regulations to put in place to keep people safe. So you have researchers and you have physicians, all kinds of medical personnel just working together to safeguard the entire community against whatever infection is going on. And then the World Health Organization is kind of similar, but it's more expansive. It looks at different places around the globe. And
you know what, I want to see if, and this is editorial, what I'm going to say, so I hope it's not bad, but I think that we need to give a break to both of these organizations, because at the beginning of the show I said, again, this is all new.
yeah,
And World Health Organization, I get it, that there is do this, no, you know what, no, do this, no, do this, we're not sure. And it confused the public, fine, we get that. But at the same time, take yourself out of your couch at home and be a person who works at the World Health Organization And they're all trying to do the best that they can with what they've got at any given time.
Right.
And at any given time, again, there's mutations and there's variants and things are moving around. And if we all just kind of sit back a little bit and give people a break,
Exactly.
I think we'd all just breathe a little bit better.
I agree.
And I would love your take on that in general, because you're probably getting shot at all the time too. Well, is it mask day or is it not a mask day? Do we wear it in the airport? Do we not? Why do we have to wear them in this city and not in the other city?
Right.
So what do you tell people when they ask you about that?
I would say do what is safe for you. I still say COVID has not gone away. It's still around. We can keep updated on the numbers in your community at that time. So if the rates are high at that time, you certainly wear a mask. If you're going to places that are crowded, for sure, wear a mask. If you're in the outdoors, it's okay to not wear a mask, because people have COVID and they don't have symptoms. Just because they're not coughing or don't look sick doesn't mean they don't have it. And if you get it, doesn't mean you won't have symptoms. You might still. So you just want to protect yourself and your family. So.
Especially in tight spaces.
Yes.
Airports, buses,
Yes.
public transportation. I think of that as just, and that's just me as a mom, right? When you're looking at the school bus,
Yeah.
when you're looking at any of those situations. And anywhere there's a mom, you thought, okay, if it's flu season, what are you going to do anyway? So it's just kind of stepping back, even 10 years ago,
Right.
when our kids, like I said, their hands are in everything, their hands are all over their mouth and their nose, and they're eating this and they're eating that and they're drinking this and that and the other. Just try to step back and refrain from doing that. We have less than 2 minutes. I want to give a couple of shout outs here, again, to the American Cancer Society for underwriting this program. A shout out to the County Medical Society, to Patsy Slaughter specifically and Elsa Shapiro, because they're watching and they're on the case when it comes to Medscape and the different websites that we have. And again, the CDC is a website you can go to, and also we had here Medscape and the World Health Organization. So I always think of that as the WHO. And Zaid, thank you so much for being here from, Zaid, what year are you in school? Third year, second year, third year? Third year medical student, and Zaid's been here before, and so I thank you so much for helping us man the phones. And again, this is our 25th anniversary of the El Paso Physician, and we will be around for quite some time. They're counting me down, so I just want to say thank you, Dr. Banda. Thank you so much for being here, and it's hard to do it all alone. Yeah. I'm Catherine Berg, and you've been watching the El Paso Physician.